Hello guys, this is Indian Medico, and in this video we are going to see about Giardiasis. This is a concise presentation for medical students. Giardiasis is a major cause of diarrhea in children and travelers. It is caused by Giardia lamblia, which is a parasite, and it is also known as Giardia intestinalis and Giardia duodenalis. Giardiasis is endemic in developing countries with poor sanitation. Now let us see about the etiopathogenesis of Giardiasis. Giardia lamblia exists in two forms. It exists as cysts outside the human body. These cysts are ingested through contaminated water or food. These cysts become trophozoites in duodenum. These trophozoites cause intestinal malabsorption and hypersecretion leading to diarrhea. Now let us see about the clinical features of Giardiasis. The incubation period of this disease is 1 to 2 weeks. The disease can be asymptomatic in some children, or it can lead to symptoms like acute diarrhea. There will be sudden onset of explosive, watery, foul-smelling stools with no blood or mucus. Other symptoms of Giardiasis includes nausea, anorexia, abdominal distension, flatulence, epigastric cramps, mild fever, and malabsorption. The disease is self-limiting. That is, it lasts only for about 3 to 4 days in normal immunocompetent children. However, it can lead to persistent diarrhea in around 30 to 50% of the cases, lactose and fat malabsorption, and failure to thrive are the other serious complications of Giardiasis. Now let us see about the diagnosis of Giardiasis. Microscopic examination of at least 3 fresh specimens of stool collected on alternate days to look for motile trophozoites or oval cysts. This picture shows microscopic examination of stool specimen of a child affected by Giardiasis. You can see oval cysts and motile trophozoites. Enzyme immunoassay and direct fluorescent antibody test can be done to look for Giardia antigens in stool. Now let us see about the treatment of Giardiasis. In symptomatic children, tinidazole 50 mg per kilogram can be given orally as a single dose, or metronidazole can be given as 5 to 10 mg per kilogram orally thrice daily for 7 days. If you have any suggestions, please let me know in the comment section. For more such videos, please check out my playlists. Thank you.